Station, Manx Radio.
Health Minister Rob Callister must have thought that Christmas had come early when he was appointed just over a month ago, with his first task being to ask Tynwald for an extra £18 million to tackle the health service's significant waiting lists. Minister Callister gives us an insight into the challenges his department faces, as well as considering the challenges faced by any MHK picking up a ministerial role for the first time. Rob Callister is enjoying his ministerial honeymoon, but dark forces have a habit of raining on the health department's parade, and there are plenty of amber warnings in the health forecast. I've always found Rob Callister to be open and straight with me, so this should be an insightful discussion. You've got a big department, a big portfolio, and just over a month's experience of how to actually be a minister. How does that actually work? Because you've got experience as an MHK, but you've never actually been in this sort of leadership role in a department before.
Not in a department. Obviously, I was chairman of Manx Utilities for the first 9 months of this administration, so I learned quite a lot in that particular role. You're absolutely right. I've gone straight from being a backbench MHK, but I have again worked in probably 4 or 5 departments over that first administration. But to come into health has been a steep learning curve. I'm going into a department that is going through a significant period of challenge and change. I'm also heading up a department that also has to address arm's length organisations, and that is relating to Manx Care and the Transformational Board. So all of those relationships have to be formed, and as the minister I have to make sure I have those good working relationships in order for Manx Care to deliver what it needs to deliver on an operational level. Manx and the Transformational Board delivering those changes and those recommendations from the St Jonathan Michaels report, and then from our point of view we need to be making sure that we're developing the strategies, the policy and the legislation, along with delivering the regulation, as well as creating the performance assurance frameworks to make sure that we are benchmarking Manx Care in respect of what it is delivering on behalf of the people of this island.
Because it was always the case that the health department basically ran the health services. That's changed, and maybe it would be helpful for people to understand how this works, because as minister you are in charge of, you are the lead person in the Department of Health and Social Care, but you're not. Well, I don't know what's your role on the Transformation Board, and certainly in terms of Manx Care. Manx Care is effectively a standalone organisation.
I mean, we'll go a step back to April 2021 when the Manx, or the Department of Health and Social Care, split. So in April 2021 we actually set up Manx Care. They are responsible for delivering the vital health and social care services here on the Isle of Man. The role within the Department of Health and Social Care, as I've mentioned, their role is to develop those strategies, policies and legislation, delivering the regulation, inspections and creating the performance assurance frameworks. And then we have the Transformational Board, and their role is to focus on delivering those any remaining recommendations from the Sir Jonathan Michaels report. My role as the current minister is to help lead the Department of Health and Social Care through a period of significant change, as I've said. It's very challenging, but I also have to be very focused at looking at the overall outcomes in respect of the performance, along with monitoring and evaluating the overall targets that the department sets Manx Care to deliver, and that is all outlined within the Manx Care mandate from March 2021. And then, as I say, I've got to have that working relationship with the Transformational Board. But on the other side, I'm also, as well, the face in respect of reporting back to Tynwald and the people of this island with regard to the changes and the services that we expect to deliver on the Isle of Man.
Just going back a step then. So how, I mean, as a new minister, you've been in, just around about five weeks now. What sort of support do you actually get? Do you get support? I mean, is there any training offered? Do you have support from other ministers? Presumably the Chief Minister is there to offer advice and support.
I get a lot of advice and support, but realistically I had an hour's handover with Laurie Hooper, who was the previous minister, and then I'm on my own really. So over the last 4 weeks I've been settling into the department. I've been getting to know the team. It is a small team within the Department of Health and Social Care now. But then beyond that, I'm then forging those relationships. So I've got a very good working relationship with the Chief Executive of Manx Care, along with the Chairman of Manx Care. And then I've obviously been introduced to the transformational team as well. Hopefully now that things are settling down, I want to get out and I want to have a look around. I want to look at our A&E departments. I want to look around our hospital. I want to look around our social services to get to know people. I want to get a feel of what people are thinking. Obviously, I want to put on record my sincere thanks to everybody that has contacted me in the 4 weeks, in this post. I'm surprised by how many people have reached out to me. And I do want to put also on record my sincere thanks to the officers within the department who've helped me to respond to a lot of those correspondence. I may have, as the Minister, I've always acknowledged and accepted those emails. But then when you get into a lot of detail of them, I really do need the help of officers to make sure it's being funneled to the right section within Manx Care and to get the answers for those people to the questions and concerns that they're raising.
Because one of the oft repeated and perhaps unfairly levelled charge is that ministers are wholly reliant on their civil servants and perhaps overly dependent on their civil servants, and without any sort of training or support to actually know how to manage that relationship, it would be very easy for the civil servant to take charge. How would you respond to that?
I think it may be in other departments, but I can assure we've got vacancies within our department and we're desperately trying to fill those vacancies. So that's not the case in the Department of Health and Social Care. I really have had to roll up my sleeves on day one, and I've found it incredibly challenging on occasions. And it has caused tension, I'll be perfectly honest with that. But again, I've been able to call upon friends within the Council of Ministers to give me some advice and support. Chief Minister has been incredibly helpful and supporting as well. But as you say, I've gone into a department that is going through a period of significant challenge and change. But I'm hoping as we go into 2023, things will settle down, and then our focus should be on actually supporting Manx Care, who are responsible to delivering the day-to-day health and care services here on the Isle of Man.
You mentioned that you've met the chair and the chief exec of Manx Care. How is that relationship? Because I have heard, and maybe this is unfair and incorrect, I have heard that there are certainly some tensions between DHSC and Manx Care. Is that the case?
Not in the first 4 weeks that I have taken up the role. I think, to be fair, as finances get tight over the next couple of years because of this cost of living crisis, because of inflation, there will be pressures and there will be times when almost certainly that Manx Care and the Department of Health and Social Care will not agree. And I think it's how you work through those problems. But as I say, I have a good relationship so far, and I really hope that continues into the foreseeable future, because the only way we are going to change the delivery and the services that people expect on this island is to make sure we have that close working relationship. But it will not be without challenge in the weeks and months to follow.
Because, of course, it is, I would say, dead easy for the department and Manx Care to reach an agreement about what needs to be delivered in terms of health priorities for the people of the Isle of Man. It becomes much more complicated when you introduce the need for finite budgets. And many of the problems, I think, that the health service faces is in relation to those financial constraints.
Yeah, I think budgeting and financing will become very difficult, and I think it will be a challenge. And especially when people are asking for new services and new drugs to be introduced, that may become more difficult, because we do have to remember that we're in a high inflation area at the moment. We are in the middle of a cost of living crisis where all general costs are increasing. So there is some tough decisions to be made. There's no doubt without that. But that doesn't mean that we can't all work together. And just to go back to your saying about the relationship between Manx Care and the department, Manx Care has just published its very first annual report. As the Minister and on behalf of the department, it's my duty to respond to that report. That report and my response is now tabled to go in Tynwald in December. And it's because it's the first one, and because Manx Care have to get through COVID, and we're still not out of that yet. But we have to give them a lenience. You can see in that report, and in our response, we thank them for all of the dedicated work, especially getting the island through COVID. But as we go into year 2, there will be more pressure applied to Manx Care to deliver those objectives, because they are under immense pressure to deliver the savings, to improve efficiencies. But then at the same time, we've also got to deliver the core services. And as the new minister, I also want to make sure at the end of this administration that people actually feel that this is a great sector to come and work in. But at the same time, we also want to change the culture and behaviour across all of, not just in the department, but also across Manx Care.
And in terms of the budget, how does this actually work in the new relationship? Presumably, Department of Health and Social Care is granted the budget, and then Manx Care is paid a particular amount out of the budget that's been granted to Health and Social Care.
I mean, according to the Pink Book for 2022-23, obviously the department was given a gross budget of £288 million. From that, we passed 283 to Manx Care. However, according to Manx Care's own annual report, they spent £279 million, which included that supplementary vote when we had to go back to Tynwald and ask for a further £9.9 million. I think what's affected that budget figure is the lack of income because of COVID and maybe the private wing being shut and increased costs. So as we go into the next financial year, things are going to be tight, and I know there'll be pressure when people ask for new services or new drugs to be introduced. That may be when things really get tighter.
And I can't think of a better time to be made minister than coming into the department and being told, Minister, we've got an extra tray of sweeties that we're going to be asking Tynwald for. It's all set up. All you need to do is deliver the speech, and there's 18 million quid coming into the department, which is between 5 and 10% of the overall budget. That must have been a nice sort of introduction.
Well, it was a nice introduction, but I think as Tynwald members shown within the debate we had, I think everybody absolutely acknowledged that we have to reduce our waiting lists. The only way we can do that is to actually punch a hole through it and to actually get them done. And over the last couple of years, we have spent £21 million in order to significantly reduce our waiting times here on the island. And we are in a significantly better place than the UK, because the UK are talking about having to reduce their waiting list due to COVID-19 over 3-4 years. So we are significantly better than the UK. But there's still more to be done, and we still need to reach that significant milestone of getting referral to treatment within 18 weeks. But we're not near that at the moment. But we have brought some of the waiting list down from 85 weeks all the way down just to a few weeks, which is excellent news. And I think it's worth mentioning that £21 million has allowed over 4,000 operations to be had. That is the quality of life for people in our community to be improved, and I think many of those will be contributing within our community. So instead of them being a burden on our health service, they're now contributing once again to our community. And I think again that is something we cannot get away from, the fact that we are helping people to better their own lives. And I think the other thing is, which was very clear from Tynwald members, we do have to make sure we report back and to make sure that we're absolutely explaining exactly where that money is being spent. But I think it's the right decision to make those tough decisions to spend the money now, because if not, then there will be a significant burden at some point, because they will be sitting on the waiting list for maybe another year, 18 months. And by that time, the cost would have increased anyway. So we have to grasp the nettle, get them done, and make the people's lives better.
And this punching a hole, I mean, just so I can understand, I understood it was 18 million that you went for. The 21 million that you're talking about is what has been spent in previous years.
£18.3 million is what I took to Tynwald, or the October sitting of Tynwald, and that was to get over 3,800 operations done. But we have also to acknowledge that in a previous sitting that we've spent around £2.1 million, and we've got about another 250 operations done for that across different parts of our health service. So we have made a significant strides or steps forward to reduce our waiting list. And what we've got to do now, and this is the responsibility of Manx Care, is that we manage those waiting lists. And I think one of the concerns that came in the Tynwald debate is we don't want to suddenly find in 2 or 3 years that we're back to this point. We've got to keep on top of our waiting list.
At 18 weeks is the target for most areas. Presumably there will be more urgent cases that need a more urgent response. But generally speaking, you're looking at an 18-week wait.
Yeah, the 18 weeks is an ultimate target, and that actually is referral to treatment time, known as RTT. That's where we'd like to strive to get. But most of the waiting lists now have either come down to a handful of weeks, or some of them are less than a year, which is significantly better than the 85 weeks that we currently had before we went to Tynwald.
So, just for absolute clarity then, after the 18 million is spent, are you able to meet this the 18-week target?
No, we're nowhere near the 18-week target. That's an aspiration that we want to achieve. At the moment, we're down towards the 52 weeks, so we've got a long way to come. But there are some waiting lists that have now come down just to a handful of weeks.
So what does the 18 million actually deliver then in terms of those reductions? Are we going to be less than 52 weeks? I mean, I'm not looking for exact figures, but are we looking at less than 52 weeks? Somewhere between the 18 weeks and the 52 weeks that we're at now?
Well, some of the procedures are coming down from day cases and inpatients from 58 weeks to just 18 weeks. There's others that have actually come down, and they're going to remove them from the waiting list. So it's a significant change. But as you say, there's other waiting lists that are still around the 52 weeks on average. But as I say, we're striving. The aim is to get it down to that 18-week referral to treatment, but we're not there yet. But it's a great start, it really is.
And of course, you referred to members of Tynwald quite rightly, pointing out there's no point in punching a hole through, to use your term, the waiting lists, only to see that you haven't got enough money to keep the waiting lists down, and they creep up again in future years. How confident are you that there's going to be sufficient budget to that this hole punching exercise is actually going to be a long-term sort of future change in what people can expect from the health service?
Well, it is actually, waiting lists are one of the key objectives within the mandate, so it'll be referenced every year. So if we see that it's an amber, or more importantly if it's a red, then we will be certainly questioning the waiting times. So it is one of the key objectives within our mandate, and the mandate is my Bible as the minister that I will be carrying in my back pocket, as I've said in a previous interview. But it's the document that we hold Manx Care to account. So, for example, some of the ones that are absolutely very clear here, they've got to demonstrate financial balance. So we know that's going to be tricky, but we've got to work with them, and that's where we're going to rely heavily on Treasury helping us to try and bring Manx Care into budget throughout the financial. They've got to embed and lead an efficient and robust corporate, clinical and care governance structure. So that's another one they've got to be done. And this is the one we're talking about, waiting times for mandated services to be reduced to levels comparable with development of health and care systems around the world. So we judge ourselves in the UK, our waiting list will be significantly less than UK, so that's really, really good. Other ones that are in there, they've got to demonstrate a continuous improvement in workforce engagement, personnel and professional development. Yeah, Manx Care also have to help us to reach net zero greenhouse gas emissions by 2050. There's some in here that absolutely that I think are absolutely right. And one of the ones that I'm very passionate about is they've got to adopt and embed a principle of continuous improvement in design, development and delivery of our health and care services here on the island. So this is the document that I will be holding Manx Care to account. And then every year, as you say, they've published their report. We will then check that report against our mandate, and then we will issue our response. And the first response going before Tynwald, I think there's only one green. I think there's a lot of amber and there's a lot of red. So there's a lot of room for improvement in year 2, and we will be working closely with Manx Care to improve that report next year.
And COVID is a fair to middling excuse for those ambers and reds.
I think COVID has put a significant pressure on the health and care service, not just here in the Isle of Man, but across the world. And I think it'll be wrong of us not to acknowledge that point, and the fact that they have to bounce back from where they were in 2019, because waiting lists have been delayed, services have been delayed. We know there's an increase for access to services. And I think one of the key things from myself, from speaking to so many people, even just in the first 4 weeks, accessing services is one of the key hurdles we have to overcome. Getting service, once you're in there, is fine. And I think most of the reports I'm getting, and I'm extremely grateful for people who come up to me and say, I've had a great service. And it's surprising, most of the complaints I'm getting about service is through email. Most of the people who are happy with the service are coming up to me. And I'm surprised it's about 50-50. So I'm really pleased with the feedback we're getting. I think majority of people are happy with the service once they're receiving it. Accessing services is one of those things we need to overcome.
At Isle of Man Energy, we have products and services to help customers manage and reduce their energy usage. From smart home thermostats that allow you to control your heating and hot water from your phone or smart speaker, through to the latest ultra-efficient boilers that use less energy and are available with extended payment terms over 5 years and warranty included. Find out more at isleofmanenergy.im or call 644 444. Isle of Man Energy. Energy for every generation. T's and C's apply.
Drive smarter, drive more reliable, drive a great deal at Mannin Motors. With a superb range of cars for every budget, always available. And if we don't have it, we'll source it. Plus, servicing, valeting and prestige detailing too. Mannin Motors, Richmond Hill, Douglas. Find us on Facebook or call 420 420. That's 420 420. Drive a better bargain at Mannin Motors.
There's Switch and Save, compromising by switching from the familiar to something cheaper. And there's ShopRite Switch and Save. There's no comparison because there's no compromise. Only ShopRite has hundreds of Sainsbury's alternatives to the usual brands. Quality you can be 100% sure of at up to 35% less. Save over a third at the checkout. With stores across the island, why shop anywhere else? ShopRite, proudly locally owned.
Above deck or below, Harbour Marine Services has all your boating needs in one place. From engine sales and servicing to charts, books, dinghies and trailers, electronics, navigation, ropes, rigging and safety. Over 2,000 square feet of stock to help you stay safe on the water. Call 822 995 or find us on Facebook. For all your chandlery supplies, set your course to Harbour Marine Services, next to Castle Down Harbour.
Crown Ballet presents The Nutcracker, November the 1st and 2nd at the Gaiety Theatre. Book now to see this glittering new production, telling the classical tale of good and evil, set to Tchaikovsky's much-loved score. Don't miss The Nutcracker, November the 1st and 2nd at the Gaiety Theatre. Tickets available now at villagaiety.com or on 600 555.
Dear Santa, this Christmas I would like more customers and more sales, please. I have been very good.
There are more reliable ways to make sure your business gets what it needs this winter. At Manx Radio, we'll create tailor-made advertising solutions to get you the results you want over the festive season and into the new year. Call our friendly sales team now on 682620 and give your business a really happy Christmas and New Year with the nation station, Manx Radio.
Can I have a new bike too?
No, buy your own.
Oh.
You're listening to Health Minister Rob Callister, MHK. Prior to seeing inflation reaching double figures, 10% at the moment, Sir Jonathan Michaels, when he did his report, he said that, was it somewhere around £9-10 million more was needed to ensure that the health service can run reasonably well. That money has been made available by the Treasury, by government, by Tynwald for that matter. Obviously, though, we've now had this 10% increase effectively is a 10% increase in inflation, because inflation has been so low for so long. How is the department and indeed Manx Care going to cope if there's not a commensurate 10% increase in budget?
Well, Sir Jonathan Michaels' recommendation was inflation plus 3.03%. minus 1.5%, which is the savings and efficiencies that Manx Care have to deliver. So that's the calculation. But obviously, I don't think when Sir Jonathan wrote that report, he was thinking that inflation would reach double figures. So we'll have to wait and see what the budget is next year. It will be challenging, regardless of where it is set, and we have to work very closely to deliver the core services. I think the pressure will come when we try to deliver new services. Where do we find the funding for that? And I think over the next 18 months, we've just got to be careful, and we've got to identify those core services, and we've got to have that really close working relationship. We've got to be honest with people when we can't deliver services, and we've got to explain that to the people, to say we can't deliver it because of this, but it's not the fact that it's not our aspiration to deliver it. So that 18 weeks, for example, where we talked about, that's our sort of gold standard we want to reach, a referral to treatment within 18 weeks. That may not be possible for 3 or 4 years, purely because of the financial pressure under at the moment. But that doesn't mean that we're not striving to reach that point during this administration at some point.
But if you're to follow Sir Jonathan Michaels' formula, we're looking at potentially a £20 million increase in the department's budget next year. And of course, there hasn't been a commensurate increase in taxes, tax take. So somewhere there's going to be some level of pressure. And, bearing in mind you've just had this 18 million vote, if you're looking for 20 million and you only get 10, a couple of years and you'll be back to where you started from.
Agreed. So we've got to get the balance right. And again, I do want to put on record that I think the department and Manx Care have had significant support from Tynwald, from Council of Ministers, from government. The question is, whatever the budget is, and obviously we don't know what the budget is until it's announced, but I think whatever that is, we've got to work within the parameters of what we get. As you say, I still think there's room for us to review some of the services. So, for example, getting the private patient ward open, and that is something I'm asking Manx Care to look at, and I'm hoping that will happen because that will generate some income. I think looking at some of the services and some of the really difficult decisions, so take, for example, prescriptions. I know everybody, when I did an interview previously, everyone thinks I'm going to automatically increase prescription charges. I'm not. What I'm asking for is there a way of actually delivering those prescriptions more fair and equitable, but at the same time raising some more income? That doesn't mean we're going to increase prescription charges. That may be a case that what we do is lower prescription charges, but what we actually do is we remove some of the exemptions for some of the classes. At the same time, we're generating some income which goes back in to deliver the core services that we need over the next 18 months. That's my idea when I had a very simple look at it. But that's one item that we could look at. Private patients is another one.
Well, if we focus for a bit on prescription charges, then I know one of the easiest things in the world for governments to do is introduce new services or free services. One of the hardest things is to then decide that actually the free service becomes a paid-for service, or indeed a service is removed. The administration that I was part of, one of the decisions that we took was that retirement age should be the age at which free things start to happen. prior to that, it had been arbitrarily picked at 60, that had been the age. That there was quite a significant public backlash against that, and yet, you can reasonably argue that people aged 60 are probably at the peak of their earning capacity in most cases. Now, I recognise some people may have retired by then, but in most cases, people are at the peak of their earning capacity.
Yeah.
So is it something like that you're looking at, or how? I suppose to start with, what is the scale of the prescription budget? What's the cost?
Let's just step back a little bit. When the NHS was set up in 1948, prescriptions, believe it or not, were free. But then in the early 50s, they started to increase charges. What we do know is that Wales abolished prescription fees in 2007, Northern Ireland in 2010, and Scotland in 2011. Now, in the UK, they charge at the moment £9.35 per item, or they offer a prepayment certificate for £30 for 3 months, or £54 for 12 months. The Isle of Man is somewhere in between. So here on the Isle of Man, we charge £3.85 per item. So we are significantly less than England. But we also have to acknowledge that Scotland, Wales and Northern Ireland offer it for free. But we are a small island with limited resources. So that opens up this discussion. Here in the Isle of Man, prescription charges total around £16 million.
So that's the income that government gets?
Well, no, that's how much it costs us.
Oh, right, okay.
Costs us £16 million. Out of that, over 95% is free in some shape or form. So as a government, we collect less than £1 million in prescription fees. So there is definitely scope there. And I know it's a difficult conversation, but if I could look at the charges, lower it a little bit, but remove some of the exemptions, and then ring fence that to Manx Care to deliver some of the core services to help us balance the books as inflation is so high and the cost of living is so great. And we know as well, I think the other thing to put on record, just to let the public know, the actual cost, as I've said already, is £3.85 on the Isle of Man per item. But we have to understand the actual cost to our health service is around £10 per item. So it is significantly being subsidised. So there is scope there to seriously look at it. And the cost for drugs due to Brexit, inflation, the raw materials, where they're coming from, it has significantly increased. And it is continuing to increase. So we have to make some tough decisions, and this is one that I feel we can make tough decisions, however difficult that may be, but at the same time trying to make the system more fair and equitable. And that doesn't mean that the Isle of Man will increase its prescription charges beyond £3.85. It may be, as I've said, we reduce it slightly, but I remove some of the exemptions. But I want to seriously look at the policy, and that's something I'm intending to do in the weeks and months to come.
And just exploring then some of the issues, because I've been there at different times of having these discussions. I mean, the argument against prescription charges is that effectively it's taxing sick people. Of course, as you've described, there are so many exemptions in there, primarily for people who have long-term conditions. That means that effectively the only people who are paying are generally people who are in normal circumstances healthy and earning. So there is a sort of an argument that says rather than paying £3.85, you should be paying close to £10. By removing some of the exemptions, you then are potentially removing exemptions from people who have longer term issues. So surely the thought, in terms of fairness, should be more about increasing prescription charges for those who can afford to pay, rather than taking them away from those who have long-term illness.
Well, as I say, I need to review the exemptions, and I think what it won't be in the future is a charge. It's more of a contribution, because as you say, at the moment, those prescription charges are around £3.85 per item, but the actual cost to the service is over £10 or around £10. So we just got to look at it and get fairness in it. I think reaching out to people who actually do obtain prescriptions and asking for their views. That's something I will pick up with Manx Care, and to see if we can actually look at this, because we have tried previously, to put this through Tynwald and the House of Keys, but it's always hit a buffer. And there's the argument around, should it be free? Should it be more costly? Should we increase the exemptions? Should we remove the exemptions? So every time it's been incredibly difficult. But as finances get tight due to inflation, due to general cost increases, maybe this is one item that it's the time that we have that tough discussion, and we actually look at people saying they will make a contribution towards their medicine, but not to pay the full cost. It'll be significantly less than that. But this, I've only been in post 4 weeks. It's one of those things I want to look at. I want it to be fair to everybody, and that's something I will pick up in the weeks to come.
Because one of the other elements to this, of course, is drug waste. And I don't know whether you have the figures for Scotland, Wales and Northern Ireland, but one of the concerns that pharmacists had raised when these sorts of discussions were going on when I was still in Tynwald, one of the concerns was, if it's free, people don't value it as much as if they had to pay something towards it. And, the concern is that there's a significant amount of that £16 million prescription budget goes on drugs which generally sit in the cupboard and eventually are either flushed down the toilet or thrown into the incinerator.
Yeah, we have to look at the waste. Again, I'm grateful people who have corresponded with me and said, they have stopped repeat prescriptions, and suddenly weeks later it's still coming in the post, or it's still there to be collected, and then it has to be wasted and destroyed. So we do have to look at the waste. This is all part of this wider review, but this is just one item that we need to seriously look at in this administration. There's a lot to look at. But as you say, that's one that's in my radar. Obviously, patient transfer is another one I want to look at, the whole patient transfer experience. But I do want to put on record my sincere thanks to the patient transfer team. This is not targeted to them. The feedback I've got as Minister is they do an amazing job for everybody that travels off Ireland for treatment. So I do thank them for their hard work. But I do want to have a look at the patient experience, when they're picked up from home, when they're taken to the airport, how they're dealt with on the flight, their experience, how they're treated in the UK, and how they come back. Because I've travelled, a while ago, and I happened to be on one of those early morning flights, and I don't feel patients are being treated fair, sometimes. And I think we need to have a look at that system. Is there a better way of allowing people maybe to be staggered? If they want to go later in the day, is there more that we could be doing over video conferences? Is there more that we should be bringing people to the island? If one of the big concerns I have got from people corresponding, and it's surprising when you become health minister how many people do correspond with you. My inbox has just exploded. But one of the things people have said to me is they get appointments in the UK sent to them, but then there's no seat on the plane the day when they need it. So they're being asked to go the day before, which is then incurring costs, because the department will only give them £50 for a hotel or £77 if it's in London. And if you're staying in Liverpool at the moment, especially on a Wednesday or on a Saturday or, any day, it's very difficult to find a hotel now in Liverpool for £50. So all of that needs to be changed. Is there ways that we can improve the system that when someone gets an appointment from the UK, there's already a ticket booked, and it is only just a case of getting on the plane and coming back the same night? Is the things we could deliver it better? So these are things I want to seriously look at, and it's only from people corresponding with me that I'm made aware that the system isn't quite right. So that's one of my priorities for this term anyway, and it is down in the department to review by August 2023. But I want to bring that date significantly forward. I know that the DOI are already looking at the transport links. But again, I want to seriously look at that as well, and I'll be contacting Chris Thomas, the Minister for the Department of Infrastructure, to look at their response. Because before I took up this position, it was surprising how many people contacted me about, the connection and not being available, and then having to get taxis. So the whole system needs a proper review.
Just finally, what in terms of budget then, February comes, the Treasury Minister gets up on his feet and says, actually, sorry, Health, you're only going to get half of what you need, in terms of the increase at least. who ultimately then takes the flack for whatever decisions are taken? Because, of course, you've got Manx Care as a stand-alone agency. Manx Care will say, well, Sir Jonathan Michael said that this is how much we're going to get, and yet you, Minister, are delivering us 5 or 10 million short. How does that relationship work? How does the whole accountability thing work there?
Well, what we've got to do is we've got to remember we have a department plan that's very clear, and we have an island plan that says we have to deliver an island of health, of health and well-being, and part of that there is a cost attached. So if we are significantly short of what Sir Jonathan Michael's formula says very clearly, then we'll sit down with Manx Care and we'll work out a strategy, we'll work out what services we can deliver, and that may not include any new services for the next financial year until inflation starts to come down and the cost of living starts to come down. But we'll have that robust discussion. We'll bring our colleagues in for Treasury. It's always my aim to have a tighter financial oversight of Manx Care going into the next administration. We'll work closely with them, and when we start to identify areas of concern, which should be on a quarterly basis, we will then bring them to Treasury's attention and we'll address them. And if at the end of that we have to go back to Tynwald and ask for a supplementary vote, then we will do. But we have to make sure that we're getting absolutely the maximum amount of value out of every pound that we spend in our health and social care system.
The relationship that you have with your members, I mean, you've experienced it the other way round. You've been a member of several departments, so you know how that works. How different is that as Minister? How do you engage with your members and keep them involved? Because I know as a Minister, you've got huge amounts of additional pressures, much more than you would have as an ordinary member in a department. And actually being able to keep your members actively engaged and involved is not the easiest of things to deliver.
No, it isn't. Obviously, I've come out of somewhere like Department for Enterprise, which is very clear, defined. I was in charge of motorsport and tourism, so I had a real good input into that decision-making process. I had a very good minister. Well, I had a number of good ministers, which were really good for my progression, as we say. I've gone into health, where health is a little bit more smaller. It's a little bit more concentrated. The first thing I did was to try and define the roles for the political members. So I've obviously appointed a political member that has responsibility for quality and safety. I have another political member that's solely responsible for legislation and policy to guide us through that. And I have another political member that's is now responsible for delivering the mandate. So the mandate's that Bible, as I said, that fixes out those objectives that we'll be holding Manx Care to account. So they've got defined roles. But as the Minister, in the first 4 weeks, I have been involved in far too much, and I've desperately tried to spread that out. But we are a young team. We are a new team, not just politically, but on an officer level. Obviously, we've got an interim chief executive at the moment. We've got, as I say, vacancies within the department that need to be filled as a priority. We need people, and that's not just the public, but also my colleagues within Council of Ministers and in Tynwald, to give the department time to settle in and to adjust, and then to allow us to focus all of our attention on Manx Care around the delivery of services and to improve services. Because, as I say, access is the hardest part. I think the actual services being delivered on the island are excellent. That's the feedback I'm getting back, which is really good. But then afterwards, we've got to focus on changing the policies, legislation. So we want to look at pharmacies, making sure that we can bring in an independent pharmacist in Ramsey as soon as possible in order to open that market and to give people choice. We also want to bring through mental health legislation. The legislation programme is massive. We need to make the changes, but we also have to listen to Manx Care, because Manx Care will tell us that we need to change certain parts of legislation in order to help them to do their job. So as the Minister, I have a lot of different relationships. It's different from when I worked in a single department where all the decisions were made in the department. I'm having to deal with at least 2 arm's length organisations, and that is really tricky, and I'm having to learn so much myself.
And as if that wasn't enough, You are also responsible, along with your members, for steering through the legislative programme that you mentioned. And again, I think perhaps members of the public really don't appreciate just how complicated that can be. You're not there purely to answer a constituent's email or even other members of the people from across the island. You have to provide this leadership role. You've got to keep your members on board. You've got to keep within budget, and when you're short of something to do on a Sunday afternoon, you've got to read through some fairly dry legislation to make sure it actually delivers what you want.
Yeah, and those are the conversations we've got to have, but they can only be done with the engagement of the likes of Manx Care, listening to what they are saying where there's gaps, listening to say where the services are not working. So, for example, as you say, the pharmacy regulations, we're going to update that as soon as we possibly can, because we know that the service is struggling in Ramsey. There is a monopoly. We know that Lloyd's Pharmacy is having employment issues, trying to recruit vacancies. So we've got to listen to all of that concerns, and we've got to try and help people, because I don't think any of us want to see people waiting 2-3 hours to get a prescription. So we've got to listen. But unfortunately, the hard part is to make that change. There is significant delays because we've realised that the regulations aren't fit for purpose. They should have been, I'll be honest, they should have been changed 3 or 4 years ago, and they never were. So now it's landed on my desk and I've picked it up as a priority. But at the same time, I'm also having to make sure that we are absolutely delivering improved services. And that's the key thing. And the access to services, as I keep saying, is one of the difficulties. But the amount of people wanting to access service is a serious concern for our island. So I was having a meeting with a doctor not so long ago, and it quite startled me to find out that here on the island, the average person used to see the doctor 1.5 times a year, which was pretty okay. But then now, the average is nearly 7 times a year. So you can see straight away there is significant pressure on our GPs. So we've now got to work out exactly why there is so much pressure. Our population hasn't grown. So why are people wanting so much now to access their doctors? And that is one of the reasons why people cannot get through to their doctors, because everybody's ringing between 8 and 9 o'clock, or they're ringing at lunchtime. So that's another thing that's a priority of mine, is to say, is there any other way we can help doctors to deliver the service better? But we have to acknowledge that they are private contracts as well. So these are all the relationships I have to forge as the minister in order to help improve the service, which is what people want, but also listen to the concern from the person who's delivering the service, which is the GPs. And every time I've gone to speak to anybody, I normally give my concerns, and then I normally get twice as many concerns back. So when you speak about GPs, they talk about how much significantly less they are paid compared to their counterparts in the UK. But that again goes back to finance, which is another problem. So it's a fascinating role. But I've never met, in the 4 weeks I've been in the role, I've actually had an easy decision to make so far.
Way back in time now, it feels. Back in 2004, I was Member for Health, and we agreed a digital strategy. If COVID taught us nothing new, the silver lining of the COVID cloud has to be how people have moved, those who can at least, have moved online as much as they possibly can, because the interactions that they need with the world, on the whole, can be conducted online. How fit for purpose would you say the health service is in terms of getting more online responses and potentially then reducing some of the unnecessary bureaucracy?
Yeah, you're absolutely right. I mean, one of the objectives within our mandate is to get our health service more digitally connected. But the problem is, again, it comes down to cost. How do we fund it? How do we make, because it's not a small amount and it's going to take time. But you're absolutely right. If we can bring it in, then it will improve the services. So maybe we have to take small bites, and as I say, GPs may be the first starting point. How do we encourage the public, maybe who don't need to see the doctor? Are they going to the doctor for the wrong reasons? Is there somewhere else they should be going to get that advice and that support? So these are all the difficult conversations, and I've come into this role in less than 4 weeks. I've spent so much time reading, trying to immerse myself into this particular role, but it's going to take time. And I have to understand all of these key problems that people want. They want to see an improvement. We also want people to take more responsibility for their own health and well-being on the island. That's a government key objective. But how do we do that when we've seen that, say, for example, there is a massive increase in mental health services and long COVID? And that's just a couple of things. And when we're talking about mental health, obviously we've seen the question in Tynwald recently about the significant increase in children wanting to access mental health services. You know, there's been almost an 83% in less than 2 years. Now we need to identify and to research what is causing that, and how can we help and support CAMHS better, because the service is overwhelmed. So there's a lot of very difficult conversations that the people of this island and the people who deliver the services here on the Isle of Man need to have, because we need to improve the services.
Well, believe it or not, Minister, we are approaching the end of the programme. It seems to have flashed by. One of the problems, or maybe not problem, one of the things that is most notable about the department you're in is it has a habit of shipping its ministers, assuming that you manage to stay in post for 4 years up to the next election. What are your ambitions? What would you hope that Rob Callister, Minister for Health for 4 years, will have achieved?
Well, I'm hoping within the 4 years, subject to finance and everything else, that people actually do see a significantly improved service. And I think that's more of the access. I also want to see a significant improvement in the culture and behaviour within the health and social care service. I want people to start looking at the health and care service as a long career opportunity, and that means getting into schools and speaking to people and say, have you thought about having a career in here? I want to see more nurses being trained here on the Isle of Man, but that again we'll have to deliver housing to help people and support people with policies and basically ideas to encourage people to be here. And at the end of it, you know, I want people to feel that we have a significantly improved health service, and I think we can strive towards that, and you know, make sure that people that need the service can access the service, because we know that the service when they get there is significantly better than what they're getting in the UK, but we're a long way off that at the moment.
And of course, government's ambition is very clear. It's laid out in the plan. So it seems as though, and certainly so far, government's been very free and easy with the cash. So hopefully, next 4 years is going to be a doddle.
I'm not sure it'll be a doddle, but I think we do need to strive to have an island of health and well-being, and allow people to take greater responsibility for their own health and well-being, but at the same time, when they need help, the help is there.
That was Health Minister Rob Callister, MHK. His department faces enormous budgetary challenges, so what do you think? Is he up to the task, or will he end up going the same way as his recent predecessors? I think his comments about the challenges he faces and willingness to consider unpopular measures such as changes to prescription charges is refreshingly honest, but will Tynwald back him if he brings forward publicly unpopular but financially prudent measures? Please get in touch with Phil Gawne at manxradio.com and let me know your thoughts and views on the programme. But for now, I'm Phil Gawne. Goramayo son geisiach rom. Thanks for listening.
Do you want to love Mondays?